In a world overrun with the fake, delusional, and disingenuous, he stands as a beacon of truth. He is Abuki Cabal. You are listening to Abuki Cabal.
Welcome to the Abuki Cabal Show.
What's happening, y'all? Shout out to all my subs. Appreciate you guys sticking around, listening to my content, and your continued interest in what's going on with our community and the vaccine and the corona situation. This one is a request that one of you guys made about what I thought about the Israelis posting vaccine data that basically indicated there was a fall off in the protection of the vaccines, i.e. the vaccines aren't working. Well, I'm going to read what the Times of Israel says about it, which indicates that, they don't, really believe the data themselves. So I'll get into it here. The Israeli study claims major drop in vaccine protection. Experts don't believe it. Reports say protection against the serious COVID-19 illness fell to 80% or 50% for over 60s patients that are over 60. The government advisor, physicians, and health statistics experts all criticize the research. So you have that. Most of the people who are on the ground don't believe these studies from this research that was done. I will read the article for you guys. There was some mention in some papers here about the data, but nothing really substantial. So I just went to Israel and I did a little research and jumped around to see what everybody was saying about it. So we'll take a look at that. Sorry about that. So here you go. The Israeli study claims major drop in vaccine protection. Experts don't believe it. Okay. The vaccine's effectiveness is preventing serious prevention. Hold on. Vaccine's effectiveness in preventing serious COVID-19 infection among the elderly has fallen to 50%, according to a new Israeli figures. But some prominent experts are saying the data shouldn't be taken seriously. The Pfizer-BioNTech coronavirus vaccines are wowing Israelis with sky-high effectiveness rates until the rise of the Delta variant. But according to the data recently raised at a top-level high health ministry meeting, immunization's effectiveness in preventing serious illness is now at 80% for the general population and 50% for the elderly. Israeli's national research body for epidemiology, the Gertner Institute, conducted the research, and Dr. Emmett Hupert from its biostatistical unit told the Times of Israel that policymakers should pay attention. The government should not be panicked, but shouldn't take the data seriously as it warns, as a warning that should not be ignored, he said. Most of us did not believe a month ago we could be in this situation. He added that policymakers didn't pay enough attention to data on the Alpha variant, which rose in Britain and spread quickly in Israel in early 2021. But as the numbers ignite concerns among Israelis, even the government's top expert advisors on the coronavirus question their integrity. The approach taken could result in a horribly skewed outcome, argued Professor Ran Balsier, chairman of the Israeli National Expert Panel on COVID-19. Any attempt to deduce severe illness, vaccine effectiveness from semi-crude illness rates among the yes or no vaccinated is very, very risky, he maintained. Infectious disease doctor Yael Paran told the Times of Israel that she can't reconcile the figures on serious illness with the much more rosy reality she sees. What we see in our hospital and around the world don't support this or doesn't support this. She said, I think the figures are exaggerated. Hubert acknowledged that the statistics have their limitations. These are early estimations based on small numbers, and there are all kinds of biases in the numbers, he said. But he insisted that despite the caveats, they still have great relevance. But Parn, a senior physician at Tel Aviv's Sourasky Medical Center, argued that the problem with them runs deep. The definition of serious illness has become misleading. It is used for patients whose oxygenation saturation drops, which was a good indicator for pre-vaccination as it signaled a deterioration. But for vaccine-protected patients, it is often a brief state that doesn't signal a significant deterioration, she said. Take a patient who is in my hospital now as an example, she said. He is in his 80s and classed as severe, but only because he had a mild drop in saturation. It was something that any other disease would cause, and which we're treating, which we're treating well with steroids. But he is classed as a serious case. Dr. Davir Aaron, an expert in health statistics from Technion, Israel Institute of Technology, said he is concerned the health ministry is using bad research and allowing it to be presented without context. The problems aren't with the vaccine, they are with bad data, he said. Branding as false the conclusions in the latest data and other research on how well the vaccine prevents infection. The research process skews the results to make the vaccine seem less effective than it is, he told the Times of Israel. The Health Ministry's data released in early July said the vaccine's effectiveness in preventing infection was over 90%. Pre-Delta is now at 64%. Such numbers are crunched by comparing infection rates and illness rates in vaccinated and unvaccinated people to measure the vaccine's protection. However, Aaron said the people who decline to get vaccinated are in disproportionately high numbers. People who are skeptical about the existence or danger of COVID-19, distrustful of health services, and overall relatively unlikely to get tested. Wow, this is badly written. We are probably only finding, through testing, a minority of instances when unvaccinated people get the coronavirus. And as the statistics rely on comparisons, this makes effectiveness for the vaccinated seem much lower, Aaron said. When it comes to the latest data on serious illness, Aaron said. The number of people factored into the calculations is so small that small margins of error can cause a major impact on the bottom line. The research process is not conducive to accurate conclusions, he argues. The overall number of seriously ill in Israel is 63. The slice of the adult population that is unvaccinated is small, and for those over 60 who generate the most troubling statistic, it is tiny. The number of unvaccinated over 60 is actually smaller than we think. Some who appear to be unvaccinated are actually dead, as it can take time to record deaths. Others are protected by recovery from illness, commented Aaron. He believes that statistics falsely pointing to poor vaccine performance are harmful because they make people more reluctant to take the shots. This hurts compliance of people with vaccinations, he said. If you're saying to the public that the vaccines work less, it hurts our enthusiasm for them. Okay. So basically, you have all of these people from all these different areas in the government in Israel who don't believe the data, because the data is raw. It's kind of early. It has holes in it, as it explains here. I'll put this in the description. And there was another story that was done on NPR about it, where they talked about it, where you can actually listen to what they were talking about what was going on. And there's another set of researchers who think that it may be, and medical personnel who think that it just may be time for boosters, because Israel was one of the first countries to actually start using the vaccine and start vaccinating its people. So it's getting around to be around the time where boosters would probably be necessary. So I'll keep looking at this, and this is still relatively new, and I'm sure there'll be more data coming in on this. So I'll just keep my eyes open. Any other questions that you guys may have, feel free to shoot them to me. I will switch over to this one, and this is August. The other was posted in July 2021. This one is newer. It's from August 2021. Highly vaccinated Israel is seeing a dramatic surge in COVID cases, and here's why. Okay, Israel was one of the first countries on earth to fully vaccinate a majority of its citizens against COVID-19. Now it has one of the world's highest daily infection rates, an average of nearly 7,500 confirmed cases a day, double what it was 2 weeks ago. Nearly 1 in every 150 people in Israel today has the virus. What happened? And what can be learned about the vaccine's impact on a highly vaccinated country or countries? Here are 6 lessons learned and 1 looming question for the future of the pandemic. 1. Immunity from the vaccine dips over time. Israel had fully vaccinated slightly over half its population by March 25th. Infections waned. Venues reopened to the vaccinated, and the prime minister told Israel to go out and have fun. By June, all restrictions, including indoor masking, were abolished. But Israel paid a price for the early rollout. Health officials and then Pfizer said their data showed a dip in the vaccine's protection around 6 months after receiving the second shot. The Delta variant broke through the vaccine. The Delta variant broke through the vaccine's waning protection. It was a perfect storm. The vaccine's waning protection came around the same time the more infectious Delta variant arrived in Israel this summer. Delta accounts for nearly all infections in Israel today. The most influential event was so many people who went abroad in summer vacations and brought the Delta variant very, very quickly to Israel, said Sedsky, a former public health director in Israel's health ministry. So as you can see that, they dropped their, the protections all the way to not wearing masks, and went so far as to go all over the world, traveling and coming back to Israel, bringing all of that back, and an unforeseen mutation in the virus was brought back to their country. And very little was known about Delta initially, and it spread through the population. I'm sure it spread through people who were not vaccinated, and also through people who were clearly not wearing masks and not protecting themselves anymore, because Israel felt like it was protected. Whereas everyone in the world, even the World Health Organization, recommended that people continue to wear masks. I guess that's one of the problems that we're going to continue to see, is that people just don't want to comply. And you see people just lazily wearing masks, wearing masks inconsistently, just being generally ticked off when you try to reinforce that people need to wear masks. It's crazy out here. But moving on to the third one, if you get infected, being vaccinated helps. The good news is that among Israel's serious infections on Tuesday of this week, according to the health ministry's data, the rate of serious cases among unvaccinated people over age 60 was 178.7 per 100,000. And it was 9 times more than the rate among fully vaccinated people of the same age and category. And the rate of serious cases among unvaccinated people in the under 60 crowd was 3.23 per 100,000, was a little more than double the rate among vaccinated people in that age bracket. The bad news, doctors say, is that half of Israel's seriously ill patients who are currently hospitalized were fully vaccinated at least 5 months ago. Most of them are over 60 years old and have comorbidities. The seriously ill patients who are unvaccinated are mostly young, healthy people whose conditions deteriorated quickly. Israel's daily average number of infections has nearly doubled in the past 2 weeks, and has increased around tenfold since mid-July, approaching the numbers during Israel's peak in the winter. Deaths increased from 5 in June to at least 248 so far this month. Health officials say that currently 600 seriously ill patients are hospitalized, and they warn they cannot handle more than 1,000 serious infections at the same time. Okay, number 4, Israel's high vaccination rate isn't high enough. The country jumped out ahead of all of the countries on vaccines, and 78% of eligible Israelis over 12 years old are vaccinated. But Israel has a young population with many under eligible age for vaccinations, and about 1.1 million eligible Israelis, largely between the ages of 12 and 20, have declined to take even one dose of the vaccine. That means only 58% of Israel's total citizenry is fully vaccinated. Experts say that's not nearly high enough. We have a very large faction of our population who are paying the price for a small faction of the population who did not go to get the vaccine, said Earl Segal of the Weizmann Institute of Science, who advises the Israeli government on COVID-19. Unvaccinated people helped fuel the rapid spread of the virus while the country remained open for business in recent months, with few serious restrictions. That will lead to mass infection, which is exactly what we are seeing now, said Segal. 5. Vaccinations are key, but they are not enough. Israel is trying to slow the wave without resorting to a new lockdown, which Prime Minister Naftali Bennett says would take an economic toll and destroy the future of the country. The country is placing caps on gatherings, increasing hospital staff, and pleading for unvaccinated people to get immunized. On Israel's doorstep, the vaccination rate is much lower in the Israeli-occupied West Bank and the Gaza Strip. Only around 8% of Palestinians have been fully vaccinated. Palestinians are wary of certain brands of vaccine and ample supply, like AstraZeneca's, while Pfizer's BioNTech's vaccine is in shorter supply for Palestinians, but the Palestinian population is not a source of transmission in Israel. Only vaccinated Palestinians are given permits to enter Israel and Israeli settlements. As for the low rate of vaccination in the West Bank and the Gaza Strip, we don't have a shortage of vaccine. It is the hesitancy, said Rhonda Abu Rabi, a local World Health Organization official working in the Palestinian territories. 6. Booster shots offer more protection if you are one of the world's lucky few to get them. Israel is the first country to offer a third shot of the Pfizer vaccine in a nationwide booster campaign. Preliminary research in Israel suggests booster shots significantly increase protection against the coronavirus a week after the person receives the third dose. Israeli national HMO Maccabi Healthcare Services, which conducted the preliminary study of 149,144 Israelis who received 3 Pfizer shots, said for Israelis above age 60, a Pfizer booster shot reduced the chances of infection by 86% and reduced the chances of severe infection by 92%. The early data reflects studies by vaccine makers Pfizer and Moderna and provides a glimpse at boosters' effectiveness in the real-world setting. After reviewing data on breakthrough infections in Israel, the U.S. announced a booster shot campaign beginning in late September for anyone 8 months after their second shot. The U.K. has promised boosters soon, and Turkey is offering Pfizer shots to those immunized with Sinovac vaccine to help citizens planning to travel, since some countries will not recognize the Chinese vaccine. Okay, now that's important because a lot of people are saying that, basically, we don't know whether these boosters will work, and we're just being guinea pigs and all of that. Well, the Israelis elected to be the guinea pigs for the rest of the world, and then we decided to do the boosters after the fact. And this is the first time I've heard of anybody bringing that up. But that's significant, and it needs to be taken into consideration. I mean, there are other countries in the world who are taking the leap to protect their citizens, and then we're going second. We're not going first. We're going second to these people. And then the rest of the world is going third to us. So that's important when people are out here spreading misinformation about, these vaccines not being tested. There's no precedent for it to be used in this manner when they're testing it in a research setting, and then they're testing it out in the field, in Israel, and then the United States goes behind them after the data has been gathered on Israelis, and then says, okay, well, we can use that. We can use that to help our people. But people aren't looking at it in that way. Okay, so Israel has lowered the minimum age for boosters to 40. The triple dose is the solution to curbing the current infection outbreak. Anat Eka Zohar of Maccabi said in a statement, Boosters are not being offered in the Palestinian territories yet, and the World Health Organization has called on countries to stop giving COVID-19 booster shots in order to help poorer countries get vaccinated. Israel very much respects the World Health Organization, but acts according to local considerations and the interest of Israeli citizens. We help the world a lot, an Israeli health official told NPR, speaking on the condition of anonymity because he was not authorized to speak publicly about the issue. If the UN didn't secure enough vaccines for Chad, Mali, Myanmar, Guatemala, that doesn't mean that Israel shouldn't seek to prevent the pandemic from happening here. Experts warn if countries do not vaccinate their populations, more variants will develop, threatening even vaccinated nations. Now, that's important. So all of the people here that are saying they're not going to get vaccinated, it's not about just your personal choice. You by doing that, are putting the rest of the population at risk because you are going to be the pool of individuals that the variants come from. And it may be something that we may not be able to get over. You have to take that into consideration. People keep just, taking for granted that we may be able to have weapons to fight against, this type of infection. But we may not the next time, or maybe two variants down. We may not be able to handle the coming storm. I mean, there's only so many chances, that nature's going to give you. Okay, looming questions. We need COVID-19 vaccines every several months. We don't know. The Cinema City movie theater complex in Jerusalem teams with young children and parents, but steps from the box office is a makeshift vaccination station where dozens of mostly older residents wait their turn to get booster shots. More than a million Israelis have received Pfizer booster shots in the last several weeks. They are being watched around the world as Israel is the first nation to give a third booster of Pfizer on a mass scale. Just as it was ahead of the curve on the first round of shots. They make the test of us, said Eddie Ben Yaakov, sitting in the vaccination booth with her brother as he got the booster shot. But in the first round, it was the same. So I don't feel it's something wrong. I think it's good. She predicts the coronavirus, like the flu, will mean shots every year. We will have to live with the corona, she said. Ido Hadari of HMO Maccabi, which led the preliminary booster shots study, questioned whether regular shots will become the norm. I don't know of any disease where we are vaccinated every 6 months. And to be honest, I don't think the public will come to get vaccinated every 6 months, Hadari said. But you cannot predict anything with this disease. Okay, there was a correction made. An earlier version of the story misspelled Weizmann Institute of Science as the Weizmann Institute of Science. Okay, so nothing really significant as a correction. And I will put this one in the description as well. But as you can see, this is something that is great, giving people a lot of pause. So, you guys take a look at this. Hopefully this answered your question. Can't remember your name that requested this, but hopefully everybody else will get something out of this. But if you look at Israel, this may be us in a little bit, so that's all I got. I appreciate you guys listening. please like, share, and subscribe. I appreciate everything and you guys sticking around with me. If you guys have any other questions, please hit me up. Let me know. And I will seek it out and try to break it down for you.
You are listening to Abuki Cabal, the analytical savage.
I feel like a motherless child.